Good afternoon, YouTube. Today is the 18th of May, 2020. Time 1:39 p.m. Pacific Daylight Time. Today is what is today? Monday. The beginning of another work week without work. As usual, streaming at you live from the Pacific Northwest in Tacoma, Washington. As usual, starting off with just the most recently released official figures about the coronavirus. As of today, the world is reporting 4,868,822 positive or confirmed cases. The world, according to the official figures, has lost 318,989 lives. Now, these counts, these figures, are going to be a big part of what I'm going to discuss today. I have pointed out numerous times the sort of discrepancy in the figures from place to place, not only within the United States from state to state, but also from country to country. One example that I pointed out a couple days ago, which I'm happy to repeat, is that if you look at Spain and Russia, two countries whose numbers of total positive or confirmed cases are relatively close together, but whose fatality rates are enormously different. To be specific, as of today, Russia, whose population admittedly is far greater than that of Spain, but the total number of positive or confirmed cases reported in Russia as of today, 290,678. Spain is reporting 278,188, a difference of, about 12,000. So a 12,000 case or 12,000 count difference when you're looking at total numbers of over 278,000. That's not that big of a difference. But what is a big difference is the reported fatality rate. In Spain, where they're reporting 278,188 cases, they have lost 27,709 lives. So almost exactly 10%. Whereas in Russia, reporting 290,678 cases, they're only reporting 2,722. But these numbers are being presented together within the same report, which gives the impression that the method for collecting this data is consistent from every region or locality. We already know that the method for tabulating these figures is not a consistent process from place to place. I don't like the way that this report, worldometers.info/coronavirus, I don't like the way the report sort of implies otherwise. Here in the United States, according to the official figures, we're now looking at 1,543,515 positive or confirmed cases in the United States. As of this morning, was reporting exactly 91,600 fatalities. Let's look a little more closely at our home country, here in the United States. It is the state of New York, which is reporting the highest figures by far. New York is reporting 360,309 positive or confirmed cases. The state of New York is reporting 28,361 fatalities. I live in the state of Washington. Our state, which was the very first state to report any cases of this virus, We're currently reporting 19,377 positive or confirmed cases. Our state is reporting 1,016 fatalities. 19,377 cases, 1,016 fatalities. I didn't sit here and calculate the exact number, but that would suggest something around, I don't know, a 5% infection fatality rate. But here's something interesting. Just like the difference in the infection fatality rate being reported by Spain and that being reported by Russia, here in the United States, similar discrepancies can be found. Tennessee is reporting 18,011 cases. But out of that number, they're only reporting 301 fatalities. I have wondered for some time, openly and out loud, on this broadcast, over on Facebook, and then once I started doing it here on YouTube, I wondered what accounts for such a difference. And I believe I have begun to find some answers. There have been questions raised over the accuracy of the U.S. coronavirus death toll. This was published on May 16th. There's a reason why some people believe government officials are exaggerating the number of COVID-19 fatalities. One problem is the hodgepodge way states tally those numbers. Some states count presumed coronavirus deaths along with confirmed cases under the Centers for Disease Control and Prevention guidance issued last month. Other states don't count those deaths. Deaths have been classified as a COVID-19 death even after a physician or loved ones reported otherwise. And those who died with COVID-19 have been included in the counts with those who died of COVID-19. Quote, I think a lot of clinicians are putting that condition on death certificates when it might not be accurate because they died with coronavirus and not of coronavirus. This, according to Macomb County, Michigan Chief Medical Examiner Daniel Spitz in an interview with the Ann Arbor News last month. Quote, are they entirely accurate? No. Are people dying of it? Absolutely. Are people dying of other things and coronavirus is maybe getting credit? Yeah, probably. Unquote. The doctor also told that he believes there are people who died of COVID-19 but weren't counted. Determining a COVID-19 death is based on each doctor's best clinical impression, and that varies. There is no uniformity, he said. The debate over whether the COVID-19 death count has been exaggerated has intensified as deaths from the virus continue to rise at a steady and alarming rate. As of Friday, there were 85,974 deaths due to COVID-19 in the United States, according to Johns Hopkins University data. The CDC was reporting 83,947 on the same day. On Wednesday, a report said President Trump and members of the coronavirus task force are pushing the Centers for Disease Control to revise the way it counts coronavirus deaths. That change could lead to far fewer deaths being counted. The president has privately questioned the number of COVID-19 deaths as the death toll surpassed 80,000, suggesting it may be incorrect or inflated by the current methodology. And that was reported by the Daily Beast. 3 administration officials said that Dr. Birx, the task force response coordinator, has urged the CDC to exclude from the death count some who were presumed infected but did not have a confirmed lab result, and those who had the virus but might not have died as a direct result of it. Last week, the Washington Post reported that at a recent discussion on the COVID-19 data, Birx told CDC Director Robert Redfield that there is nothing from the CDC that I can trust. Again, this from Dr. Deborah Birx. Quote, there is nothing from the Centers for Disease Control that I can trust. Now, I mentioned the state of Tennessee. The state of Tennessee showing such a vastly different infection fatality rate from that which we calculated here in the state of Washington. Tennessee doesn't count presumed COVID-19 deaths. It had 273 COVID-19 deaths as of Friday. The state's health department said it tracks those deaths but isn't reporting them. Quote, some of those pan out to be actual cases or some of them don't. We collect that information and have actually had significant discussion on whether or not to post that information. Have no problem doing it. We just don't see that it adds a lot of value until we actually have a confirmed case or not. The state of Colorado counted a man who a county coroner said died of acute alcohol poisoning as a COVID-19 death. Man drank himself to death, but his death is being now counted among those who have been killed by this virus. Colorado Montezuma County Coroner George Devers told the Durango Herald the man's blood alcohol level was 0.55, or almost 7 times the legal driving limit of 0.08 in Colorado. A blood alcohol content of 0.3 is considered lethal, and this man was at 0.55. Quote, COVID was not listed on the death certificate as the cause of death, Devers said. I disagree with the state for listing it as a COVID death, and we'll be discussing it with them this week. End quote. The man who drank himself to death and who is now being counted among those killed by coronavirus was a 35-year-old man by the name of Sebastian Yellow, and he was found dead by police May 4th. The state is reporting that as a COVID death, but our health department wanted to let people know that even though the person did have the virus, they did not die from it. And that was a statement issued by the Montezuma County Public Health Department. So things like this are happening all over the country, all over the world. I think that it is an important thing that we wonder exactly why somebody would want to behave this way. People are dying from all kinds of different things. People in nursing homes, aged 91, who had been in hospice since January. It wasn't until January 20th or 21st that the United States reported that it had even identified any cases, much less fatalities, in the United States. A 91-year-old man in hospice since January who passes away is now being categorized as a COVID death. The mortality rate, which is a point upon which I have devoted considerable attention, I simply calculate as a fraction, the numerator being the number of dead, those presumed to have died from the virus, and the denominator of that fraction being the number of confirmed cases within a certain region or area or state or country or whatever. Simple division. One thing I have pointed out repeatedly is that with the advent of seroprevalence testing, blood testing to find antibodies, that the denominator of that fraction is subject to enormous variation, whereas the numerator, being a static figure that doesn't change, is the death count. But now it seems within these figures, within these percentages and fatality rates, that both elements of that fraction are now in question. Here in my home state of Washington, in stark contrast with other states, our state government is not even releasing the number of deaths which occurred in assisted living facilities, nursing homes, hospices, etc. Not only that, the state is not releasing which facilities were reporting these deaths. And they're also not reporting the amount or the number of deaths which involved serious comorbidities. Other states, such as Minnesota, are quite open about that information. I believe that Minnesota reported that 99% of their citizens who have passed away from coronavirus had at least one serious underlying illness. 99%. But here in the state of Washington, that information has been withheld by our state government. Why? I have no idea. This is from National Review. How many COVID-19 deaths are there? This published just yesterday. How many COVID-19 deaths are there? It depends on whether a person dies of the virus or with it. States should count and publish both numbers. Deborah Birx, the physician advising the White House's coronavirus task force, gave voice to a real concern earlier this month. She told officials from the Centers for Disease Control that some of its numbers on mortality and case count could be inflated by up to 25%. Quote, there is nothing from the CDC that I can trust, end quote, the Washington Post reported Birx saying. We now know more about what she's talking about, since Colorado has become the first state to publish two different numbers. One number is derived using a definition mandated by the CDC, which issued guidelines on March 24th specifying that, quote, COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. The second is a narrower category called deaths due to COVID-19, which is limited to people who actually died of the disease. Counting in this way results in a decline of 23% in reported COVID-19 deaths. What's going on here? There have been many outlandish examples of people dying of things bearing not the slightest connection to COVID-19, but having tested positive for the coronavirus, they were added to the official COVID-19 death tally anyway. There was the Lehigh Valley, Pennsylvania man who slipped and fell at home. The coroner said, according to LehighValleyLive.com, the primary cause of the man's death was a head injury from a fall at home, but the virus was listed as a contributing factor to his death. In April, a 37-year-old California man died as a result of a drug overdose while infected with COVID-19, a significant contributing condition, according to a county spokeswoman named Ashley Bautista, per the Ventura County Star. Last week, there was the entry in the Cook County, Illinois Medical Examiner Ledger. Complications of opiate, probably heroin toxicity, novel coronavirus, end-stage renal disease, hypertension, accident. Oddities, all, we were told. Aberrations, insignificant to the overall count. Except we know they were not. Republican State Representative Mark Basie accused the Colorado Department of Public Health and Environment of fraudulently altering death certificates in cases in which coronavirus-positive individuals died, but the medical examiner did not list COVID-19 on the death certificate. Basie, in his request for an investigation, cited a letter from the Summerlin Glen Nursing Home to staff, residents, and their families, saying that CDPHE had overruled physicians and added COVID-19 to 7 death certificates. CDPHE came under more fire when they added the death of a 35-year-old man who died of alcohol poisoning, who happened to be coronavirus positive, to their official tally. Their defense was simple. They said they were just following the CDC definition. Quote, "We classify a death as confirmed when there was a case who had a positive SARS-CoV-2 laboratory test and then died," CDPHE said in a statement. Democratic Governor Jared Polis could have circled the wagons, but to his enormous credit, he ordered the state to publish the 2 different numbers. He told Fox News Sunday that the new approach is a better way to inspire confidence in the data on the total number of virus victims. The numbers differ considerably. At the time of Colorado's announcement on Friday, the CDC definition tally used in CNN's dashboard and all the other media reports stood at 1,150 statewide, but only 878 of those, more than 23% less, are identified as deaths due to COVID-19. This language appeared Friday on the state's website, along with the new numbers. Beginning May 15th, the department began reporting the number of deaths in 2 ways. The number of deaths among people with COVID-19. This represents the total number of deaths reported among people who have COVID-19, but COVID-19 may not have been the cause of death listed on the death certificate. This information is required by the CDC and is crucial for public health surveillance, as it provides more information about disease transmissibility and can help identify risk factors among all deaths across populations. The number of deaths among people who died from COVID-19. This represents the total number of people whose death was attributed to COVID-19 as indicated on a death certificate. This number is determined by the CDC and is updated daily for dates through the previous Saturday. Now, there is no doubt this virus flashed through nursing homes with devastating effect. We have cataloged the death toll in these spreadsheets. But if we don't fix the definition, residents of nursing homes, which are now being tested wholesale for coronavirus, who have mild or asymptomatic infections will show up in the COVID-19 death count when they die from any of the maladies from which people die. The median nursing home stay before death is just 5 months. If this definitional problem isn't fixed, the tallies will lose all contact with reality, with attendant public panic and additional economic hardship. Colorado has taken the lead. Baisley lit the fire, and Polis stepped up to exercise genuine leadership. All governors, Republican and Democrat, should follow his lead and report both sets of numbers. And the CDC should fix its nonsensical definition, which didn't even exist until March 24th of this year. There needs to be consistency. There needs to be consistency in the way that the information is gathered, the way that deaths are tabulated, and in the way that these figures are presented. There needs to be more than just numbers climbing higher and higher every day, inspiring people to be afraid, inspiring people to hide and withdraw from life. That's the effect these numbers have, especially given the way that they are presented in the mainstream media, the context within which they are presented in the mainstream media. One point that I made some weeks ago on worldometers.info, each country, and then within the United States, each state is listed according to its total number of positive or confirmed cases. But the United States is a country of some 328 million people. So when we report 1.5 million positive or confirmed cases, it's 1.5 million positive or confirmed cases out of 328 million. Spain, for example, has a population of roughly 60 million, less than 1/5. Would it not be a better idea to list these countries based on their infection rate? It would make more sense to me. Of course, a country with 5 times the population of another country is going to list a higher number of cases. I think it would make more sense to indicate what portion of their population is infected. Same thing with the states. And speaking of the states, here in Washington, we are currently in phase 1 of what is to be a 4-phased reopening of our state, with a gradual and incremental easing of restrictions. There was said to be a minimum of 3 weeks between each phase. But our governor, Governor Jay Inslee, can't guarantee that our state will enter phase 2 of reopening on the 1st of June. This is from king5.com. Governor Jay Inslee spoke with members of the retail, auto, and hospitality industries on Thursday to discuss the progress that's been made and the next steps to reopen. While saying the state has made progress, Governor Jay Inslee on Thursday said there's no guarantee the next phase of reopening the state will occur June 1st. The governor also hinted he may change one of his requirements for restaurants to offer limited in-house service. Inslee has said restaurants would be responsible to get names and phone numbers of customers in case they need to be contacted about potential exposure to coronavirus patients. But on Thursday, he said that requirement could be made into an option. The governor was joined by members of the retail, auto, and hospitality industries in Washington Thursday to discuss the progress that's been made in reopening the economy amid the pandemic. So our state is still in a state of uncertainty. We have a basic, somewhat nebulous framework for exactly how fast life can be ushered back into some semblance of normalcy. But we just sit watching the news each day, looking for something solid so that we can begin to plan and to orient our own individual personal lives towards readjusting to the life that was taken from us 2 months ago. How is this all going to end? I mean, permanently end. Well, I've been saying it for some time now. Many people have been saying it for some time now. It won't be until a vaccine emerges and can inoculate the entire population forever that we can truly see an end to this. And there is some promise being shown in our efforts to locate such a thing. This is from the New York Times, published today. The first coronavirus vaccine to be tested in people appears to be safe and able to stimulate an immune response against the virus. This according to their manufacturer, Moderna, and they announced this on Monday, today. The findings are based on results from the first 8 people who each received 2 doses of the experimental vaccine beginning in March. Those people, healthy volunteers between the ages of 18 and 55, made antibodies that were tested in infected cells in the lab and were able to stop the virus from replicating, the key requirement for an effective vaccine. The levels of so-called neutralizing antibodies matched or exceeded the levels found in patients who had recovered after contracting the virus in the community. Though encouraging, the findings do not prove that the vaccine works. Only in larger, longer studies Rather, only larger and longer studies can determine whether it can actually prevent people in the real world from getting sick. And this story goes on to caution people not to assume much from these findings. Encouraging though they may be, it's going to require testing on a much larger scale to make sure that the virus doesn't cause conditions to get worse, doesn't have adverse side effects. We're only talking about 8 people. We need to manufacture over 300 million doses. Sometimes, I mean, the numbers that have been bandied about a coronavirus vaccine between 12 and 18 months is what we keep hearing from people. That's what we've been hearing for months now. But it can take decades for a vaccine to make its way from the initial stages of testing out to the market. Our government, our federal government, has instituted something called Operation Warp Speed, with the goal of having a viable vaccine available to the public by January, barely more than half a year from now. And these trials, these tests, they're encouraging. They're giving us reason to believe that given the right motivation and the right resources, that the various facets of our federal government have the ability to deliver the results for which we've all been very anxiously and desperately waiting. I maintain that even once this has all ended for good, the effects that it's had on our lives and on our culture and society at large will be permanent. I don't see that there's any total recovery from this. This changes everything forever. Exactly how the permanent effects will manifest themselves remain an enigma. We're just going to have to wait and see. But there can be no doubt things are going to be different. I'm anxious to see exactly how this all ends. It's going to be a busy 2020. So much going on. And I'll be here to watch, to contribute and participate in it in any way that I'm able to, process it through my own lived experience and my own point of view, and share with people what I think of it. Thank you for listening. Be good to each other.